Hello everyone, I am Dr. Vijay Rao, Rheumatologist at Divisha Arthritis and Medical Center. Today we will learn about very rare autoimmune disease called vasculitis. Vasculo means blood vessel, itis means inflammation. Very simply. So blood vessels are tubes, they are pipes fitted from the origin is heart. Imagine heart is the engine. From that big blood vessel called aorta, which is like a hose pipe, goes from the heart to down and up, supplies different parts of the body. The more closer to the heart, bigger size of the blood vessel. The more away from the heart, smaller size of the blood vessel. Now let's come to what is exactly vasculitis. It is an immune system defect where our own immune system starts punching holes in these blood vessels. So the blood vessel starts leaking, become more bleeding issues will happen. So if it's skin, you start having rashes where all it can cause something called purpura or vasculitic ecchymosis or spots in different parts of the body. So those which are affecting skin, those blood vessels are very thin, like hair like. They are called small vessel vasculitis. Those which are affecting organs are medium and large vessel vasculitis. So large vessel vasculitis generally causes loss of pulse, BP not being able to record, giddiness, or it can cause neck pain, chest pain on exertion, breathing difficulty. It affects intestines, then food easily cannot get digested, severe pain when eating food because during digestion blood flow increases to the gut, and if there's blockage in those blood vessels, heat, swelling and stiffness in the walls of the blood vessels, and the blood flow doesn't happen. If it affects the neck blood vessels, it can cause stroke. If it affects the heart supply of blood vessels, imagine the heart has to keep pumping like this. It's a muscle, and for that to pump like this, blood has to supply to the heart muscle. So heart is pumping blood to other organs, but for that to receive food, the muscles need to be supplied through blood vessels. Those are called coronaries. So if any of the heart blood vessels get blocked because of heat, swelling and stiffness, not because of cholesterol, because of heat, swelling and stiffness related to immune cell, then heart attack happens at a very young age. These patients are less than 45 years having heart attacks, they're having strokes, they're having kidney problems such as renal infarcts, no blood flow to the kidney, bowel problems such as no blood flow to the intestines. So these are serious conditions. It can be mild if it just affects the skin. It can be a bit severe if it affects brain, heart, kidney, lungs, so on and so forth. Rheumatologist is the only doctor who is able to diagnose these problems. So, based on the symptom of these patients, if there's continuous fever, lack of appetite, weight loss, skin rashes, cough, breathing difficulty, or any kind of stroke kind of features, heart attack features, or digestive problems, any of these symptoms makes the rheumatologist to do the right kind of scan. Usually angiogram is what is done through a CT scan or an MR angiogram, or a PET CT scan called positron emission tomography, PET, where a glucose dye is injected and taken pictures of where the blood vessel problem is, and based on that a large, medium or small vessel vasculitis is diagnosed. There are many types here called ANCA vasculitis or Wegener's granulomatosis, or polyarteritis nodosa, microscopic polyangiitis, Takayasu arteritis, giant cell arteritis, Behçet's disease, Kawasaki disease, IgG4 disease, and recent more ones like Dada syndrome or Vexus syndromes. These are more diffuse descriptions. But the nutshell is blood vessels become leaky and blocked, and the organs suffer and die. So, if treated early, the rheumatologist treats with good amount of steroids for the first 3 months to 4 months, followed by tablets such as methotrexate, mycophenolate, azathioprine, or sometimes if severe can be using injections through drips called rituximab, which blocks the B cells producing these chemicals causing this blood vessel problem. Blood tests such as ANCA is useful in small vessel vasculitis where it affects the kidney and the skin, and ENT causing sinusitis problem, nose crusting or bleeding, or can affect kidney or skin. So if treated early, patients usually recover well, and treatment minimum required for 2 to 5 years, and gradual reduction should be there. Sudden stoppage and careful monitoring with rheumatologist is mandatory. You can lead a normal life with treatment but you have to be in touch with a rheumatologist who can save you from getting any of these serious complications. I hope you have benefited from this. I wish you all the very best.